Okay, thank you guys for joining us. As we know, spine surgeons often assess the success of surgery based on surgical outcome. Surgical outcome may include patient-reported outcome, radiographic, psychological factors, medication intake, and disability factors. Over the past decades, we see more and more physicians using functional outcome measurement to assess their patient's disability. The physicians that are using functional outcome measurements, along with the promise data and radiographic data, can give a more robust information about the patients, hopefully to create more patient-specific treatment plan.
Yeah, with the advancement and technology, advanceable kind of wearable technology, these things are becoming more kind of widespread in its use, and I think this is something that will kind of take us into the next step in the future in spine care and being able to take care of patients who have these complex spinal issues and problems and being able to just track their care. I think it's a up-and-coming technology. That's something that I look forward to kind of seeing the next, what's to come from it.
Yeah. So Addison, let me ask you a question. What does a wearable device mean to you as a spine surgeon?
Yeah, a wearable device to me, starts out as everyday devices that people use, like a Fitbit, smartwatch, their smartphone, or even smart clothing that they use, typically to collect activity and health data for themselves, but translating that into more clinically relevant information to track post-operative activity levels, maybe translate that into something that's more functional, like angular data on how they carry themselves, or activity that they do after a major surgery, or even maybe before, to help track changes that are meaningful to the surgeon and for the patient's outcome as well.
Yeah, and we see more wearables in the sport field, when actually consumers using the wearables to improve the performance, basically, and improve the quality of life. We see a bunch of runners using also overly smartwatches, and they're all about the heart rate, the steps, the miles per day, etc. But however, these wearables can be used clinically. We can track our patients in the rehab phase in their life. We see if they're walking like they should walk, or if they're walking more than you should walk, and give us some red flags to use it. So Webb, let me ask you a question. So what are the components of wearable devices, and what they actually can measure?
Yeah, so there are a lot of great components to wearable devices. They're lightweight usually, cost effective. They're these things that you can get kind of over the counter, pretty cheap, and doesn't cost a lot. They are something that's not really intrusive to our daily life. So you can have one of these wearable devices on, not even really know it, and just kind of go about your day. But it can monitor certain aspects, such as Dr. Woods mentioned, the heart rate, your steps, how many steps are you taking. It can monitor your oxygen levels, especially with the Apple Watch, and there's some wearable devices that can measure your electrolytes and the amount of glucose that's in your body that's important for diabetics. So I think there are a lot of great applications. There's a lot of newer technologies and companies that are coming out that can really assist us as surgeons in better taking care of patients. So,
yeah. Now I'd like to talk more about the components of wearables. So the most common one is accelerometer, which we have with Fitbit, that basically tracking motion. Inertial IMU, inertial measurement units, basically. It's a combination of acceleration, gyroscope, and magnetometer. This is what the future going to hold for us. So let me ask you both of you a questions. So what are alternatives for wearable device, or how are you guys assessing functions with your patients right now?
Yeah, so there's the patient outcome measurement information system, or the PROMIS system, that can be used now, that collects really good information, but it has limitations with subjectivity, personal bias, and sometimes can be time dependent. So that can be somewhat limited Whereas a wearable device, you may be able to track over a longer period of time. It's objective data. You don't ask it questions. It just gives you data that's very objective that you can go off of, rather than like the promise information. So.
Yeah, I agree. There's functional outcome scoring systems that we use that have limitations. We do physical exams for patients, pre-operative, post-operative, in the office, but that just gives a single snapshot in time. I think having a wearable device can monitor from a longitudinal standpoint over time. How's the patient doing in terms of their activity, their walking ability, their posture. Those things are some aspects that we kind of are limited in terms of obtaining in the current situations and my current practice.
Yeah, and for more sophisticated solution, some physicians are referring to a motion lab for a gait analysis. Gait analysis can provide you a detailed report of the patient's functions, starting from kinematic, how fast are they walking, range of motion of each joint, amount of sway, total sway, range of sway while they're standing or bending over. Neuromuscular data like muscle onset, magnitude, what muscle they're using, core contraction, coordination between the muscle, or kinetic data like pressure med, ground reaction forces that can basically calculate the forces applying on the patients. However, gait labs are not always available for all of us, and if they're available, they're not always covered by the insurance. So sometimes the patients need to pay out of pocket, or the clinic have to absorb the cost of gait analysis. On top of that, the maintenance of a gait lab is pretty expensive. Usually need to hire at least one PhD and a couple masters levels to run the lab and to provide you all these details report. This is what wearables is a good solution to, I won't say replace, but be alternative for full gait analysis, basically. And we see more and more papers coming out, not in spine, but in other orthopedic fields, that actually showing the benefits of using wearable device on patients before and after surgery. So let me ask you, Addison, so based on your knowledge, in other orthopedic fields, what are wearables they are using and how they're using it?
Yeah, it's becoming more common for wearable devices to be used, such as like orthopedic sports and with stroke, hip preservation, areas like that in orthopedics, where they are able to track over time their activity levels in their patients. The smartwatch is one that's used frequently by patients to track, caloric intake and caloric use through activity levels, heart rate, O2 levels, and things like that, that we can translate into usable data for a spine surgeon. And those things are currently used in, orthopedic sports, stroke, and other patients, but largely in spine, those have been exploratory sort of areas that haven't been breached yet.
Yeah. So besides the wearable, which is the most common item we have right now, we start seeing more and more smart clothing, especially in the sport medicine arena. We start seeing smart shirts, smart sleeves to detect shoulder and elbow injury. We see a bunch of accessories like rings, necklaces, ear pods. Those can track also kinematic or steps or any other information.
Yeah, also in the military as well, using a lot of wearable devices to just monitor soldiers and the people that are on the front lines. So a lot of times at these remote locations, there's no provider or way to, let's say a soldier has some medical condition that needs to be monitored. I think that's a useful application for it, as well as kind of in the actual fight itself. So a lot of the wearable devices, such as iPads, the soldiers that are on the front lines, they're wearing these devices that can send information back to transmit information that we didn't have before in the past. So it's A lot of applications for that as well.
Yeah, and we want to keep our soldier healthy. So this got a good way to detect if they're doing more that they should do, if they're bending more the trunk that they should do, especially with carrying all these heavy loads, bending too much. So we want to pull them off the front line, treat them, and then send them back healthy. So Webb, let me ask you another question. So how wearable device can help you in spine care?
Well, I think there's a lot of added benefits of wearable devices. Patients that come in and we're able to just get a single snapshot of their objective history in terms of what's going on with them at that point in time. Some patients, they don't take medications when they come in to see me as a provider just because they want to, they don't want anything that interferes with their symptomatology. So wearable devices can serve an important role in terms of monitoring a patient's activity level after surgery. It can send an information to me that keeps a snapshot or over the week or 2 weeks or over several months, and how is this patient doing in terms of their post-operative care? Are they walking too much? Are they not walking enough? How's their posture? Are they wearing their brace? All those things that can really assist me as a surgeon in terms of better taking care of patients and better managing their care.
Yeah, and I want to echo you on that. I mean, there's not a lot of information what the patient is doing right after surgery, right? Obviously, we don't want to pull them, bring you to the clinic a week after or 2 weeks after, but all those like microcystomy and small procedures, patients actually start functioning the next day.
Yes.
And there's not a lot of information right now out there or publication on that, which wearable device can provide us information. Yeah. On top of that, I want to just mention that unfortunately, our patients becoming younger and younger, and we start operating on patients in the 30s and in the 40s. This generation already own a smartwatch, a smartphone, and they're more open and willing to take care of the treatment plan and be committed to get better, basically. So I think this is a great opportunity, and it's a nice window that we can use to push these wearable devices and use it more for better outcomes.
Yeah, and I think maybe the next step going forward in the future of wearable devices and spine may involve artificial intelligence and predictive algorithms that may be able to predict an injury or prevent injury going forward, and also give us some more detail about the mechanism of injury as far as wear and tear or certain activities that put someone at higher risk. And additionally, I think it helps the surgeon really connect with patients to really make them aware that their surgeon is following their care on a longer term basis rather than every couple weeks or 6 weeks. It makes them feel like your surgeon is a part of the care whenever they're involved with something that's a continuous process, like a wearable device that puts data, into the surgeon's hands and the patient's hands. That's the reality there.
Yeah. So all good and promising hopes we got over here, but let's talk about the limitation or the challenges that actually are with wearables. What are your thoughts about that, Webb?
Yeah, there's some people that may not feel comfortable just having someone monitor every aspect of their care. There are a lot of people, especially the younger generation, that are into iPhones and technology, and there are some people that just don't want to be a part of it. So I think that's one limitation. Another limitation would be the privacy concerns with transmitting confidential data. I don't think that part has been quite figured out yet, and that's still something that has to be worked on. So I think privacy concerns and also just people kind of adopting the new technology.
Yeah, and on top of that, battery life. So you basically adding another test for your patients to make sure they're charging the smartwatch, make sure they're wearing the sleeve, wearing the braces with the IMU sensor and it. So this is another aspect of that. Okay, so to sum everything up, so what is your take-home message about wearable devices in spine care?
Well, I think there's a lot of promising data that's kind of out there, and hopefully more to come. I think as we advance spine care and develop new technologies, just having wearable devices is just one part of that, and being able to monitor patients before surgery and after surgery and help make decisions based off of that, I think that's very promising for wearable devices, and I'm really excited to see where it takes us in the future.
Yeah, very exciting. I just want to say that a combination of functional outcome measurements, which wearable device can help us collect more data of that. But taking a combination of these functional outcome measurements with the common, radiographic and promise and bone density and motivation can provide the surgeon a better pictures or better assessment of the patients, and hopefully can start doing patient-specific treatment based on the functions and based on their motivation.
Yeah, I agree. I think that wearables can really bring another dimension of data to the surgeon and patient in the preoperative, perioperative, and postoperative period that is really objective and kind of tie everything together. And that's the future, possibly of wearables.